Hi, good evening. I'm Thomas Knappel. Our big idea is on building intelligent conversational agents for mental health interventions in perioperative settings. Surgery is a traumatic and life-changing event. In addition to tissue trauma, it also causes significant psychological trauma. And psychological trauma makes people sad. In addition to that, it causes chronic stress, depression, anxiety, all of which in a pre-surgical setting can lead to significant deleterious effects post-surgery. And what happens often is acute, with respect to pre-surgical stress, it leads to acute post-surgical pain, increased anxiety, inability to sleep, and a feeling of hopelessness. In addition to that, all of this also leads to significant deleterious outcomes in the hospital, like increased length of stay, increased costs associated with it, and most of all, and most concerningly, dependence on opioids in the long-term care. So what do we do? Our approach is to build a prehabilitation, a just-in-time adaptive prehabilitation which focuses on wearable devices and intelligent conversational agents that are delivered at the point of care. And our approach is not later, but now. And towards this end, what we'll do is we'll use wearable devices in order to detect both heart rate variability and respiratory rate as a combination, and use that to develop models of stress, and use that to trigger intelligent conversational agents that will deliver therapy to the patient at that point. Our approach towards this just-in-time adaptation is driven by two things. One is the just-in-time factor, and the second is also detection and delivery at the same time. And we rely for a lot of this with 5 distributed components in our system architecture with the use of Amazon Web Services components. Our approach is also technically novel, as opposed to prior research, which has gotten very good at prediction and detection. There's been very little attachment to what happens after that. Most of the outcomes that have been predicted in the past have been distal outcomes, which are far removed from step counts and patterns. In addition to that, what happens as a result of these distal outcomes, which is what we call in cognitive and behavioral sciences bridges too far. Primarily because these use from a time-band theory from Alan Newell is the idea that if you think of detecting outcomes and trying to develop interventions based on that detection, you need to be within time bands that are within the same time band or within adjacent time bands. When you think of these step counts and things that we've used in the past, these are bridges that are considered too far. So our approach is to detect these within these adjacent time bands, within the cognitive and the rational time band, trying to deliver therapy to the patient at the right time, reduce the suffering, and towards the end we have a really good team. And I feel happy that I didn't use the word machine learning or AI.
So talk to me about the conversational agent. How mature is this technology to be able to detect stress accurately?
Right. So last year, I'm going to go to a little bit of a story just to come back to the question. So last year, for the Amazon Alexa challenge, I was part of a team that built a mood-based challenge called Diabetes for diabetes support, essentially. So how mature is it? It detects problem categorization. How good is it at conversations? It's still an evolving technology because the locus of control is still when to take the break, when to stop, when to ask the questions. These are very hard to do in a conversational agent, right? But we don't in the proposal. So there are too many moving parts to the proposal that I've done. It's got a lot of machine learning, a lot of artificial intelligence. So the therapy part, at least the conversational part that we envision, is fairly simplistic, like mindfulness-based meditation therapy, which does not involve a significant conversational interaction, because I think that's putting too much on the conversational agent on a watch, right? So it's kind of complicated. So the second part of it that I want to say is we've done more advanced conversational modeling, again, but it's on very simple tasks, right? So we try to build a problem-solving therapy conversational agent on Alexa. It's good at detecting problems that people say, but the conversations as a therapist, it's still a work in progress. The last point I want to make is that the workload in building a lot of this is on the Amazon side as opposed to, like the web services are pretty mature in doing a lot of these processing. So we feel pretty confident in doing a lot of these, offloading a lot of these off to them. So it's getting there, I think.
It seems like there's one piece of the story which is around detecting need,
Correct.
and then the second piece of the story is around the actual intervention.
Correct.
Why not just have it all be all intervention and have people opt out if the need is not there? Because it doesn't seem like there's a cost of intervention.
No, there isn't.
So why do you need the predictive piece at the front end?
So I think there's two ways to answer that question. One being that why would you deliver a therapy for somebody who's probably not in need?
Even though you're saying some of it's like mindfulness, right? Which means
it be useful anyway, right? No, I agree with you. It's potentially a strategy which we've not fully thought through that process yet.
But I think there could be value, but I'm just curious what it is. So is it that your utilization is going to be higher if it's targeted, if it comes to me when I'm actually depressed versus if I'm not, that I might be more likely to use?
Right, so I can make a counter argument that, argument that even if you deliver it at the right time, it could be at the wrong appropriate time for the patient or the participant because of the lack of context awareness, right? I don't want to be disturbed at this point to do mindfulness therapy. So there's a lot of moving parts to specifically building this, but I think the key here is that we want to connect the condition or the situation to an event, to an intervention that's associated with it. So that was the sort of the conceptual principle behind it. Is there value in having just the intervention without the detecting value? Sure it is.
All right.